All right, so we are presenting for healthcare, HCA and Tenet Health. This is for Abby, Melissa, Kirsten, Joanna, Taylor, and Carrie. Our company of emphasis is Tenet Healthcare, and our compare company is the Hospital Corporation of America, or HCA. So we are going to go over the HCA healthcare, and then we're going to go over Tenet Healthcare. We're going to do the external analysis, then go through industry analysis, then firm analysis. We'll go through the SWOT analysis, vertical analysis, horizontal analysis, ratio analysis, and conclusion. So about HCA, the headquarters are in Nashville, Tennessee. It was founded by Thomas First Sr., and Thomas First Jr., and Jack Massey in 1968. There are 182 hospitals and 2,300 plus clinic sites in 20 states in the United Kingdom. The clinic sites include surgery centers, freestanding ERs, urgent cares, diagnostic and imaging centers, walk-in clinics, and physician clinics. There are more than 29,000 employees that provide treatment for over 37 million patients per year. HCA's largest acquisition includes Kindred at Home and Brookdale Senior Living Community, and they provide charity services totaling over $3.5 billion in 2022. So about Tenet, it was founded in California in 1969, and the current headquarters are in Dallas, Texas. The clinic site includes 475 ambulatory care centers, 61 hospitals, and 110 outpatient centers in 35 states. There are over 100,000 employees with 8.5 million patients treated annually. The largest acquisitions include Vanguard Healthcare Services and Surg Center Development. Ambulatory care centers contribute to 22% of the growth in 2023. So now we're going to go over the external environment, the pest analysis. So the pest analysis is a management tool used to look at factors that impact the microenvironment of a firm, risk and opportunities in strategic planning. So we'll start with the political environment, the changing healthcare industry, the US GDP, elections, budgets. It's all a part of the political environment, changes to government programs impact that environment. The cutting of these programs can risk these opportunities. So we'll talk about the economics. Unemployment rates are a big factor as well as inflation rates. When we have unemployed people, they're losing their insurance. This can lead to these bills not being paid for hospitals. So these unmanageable bills with healthcare systems, it's a problem. With the social environment, the location of these facilities can impact these different healthcare systems, as well as the growing holistic environment within the healthcare. And then with technology, the updating of electronic medical records, as well as like updating of MRI equipment and other equipment, has an impact to the healthcare systems. And then with virtual visits, being able to outreach to different people that may be outside of the community also impacts healthcare systems.
All right, so the next part is the industry analysis for the Porter's 5 forces to help identify competition that impacts our overall profits as a company. Number 1 is industry competition, and that is low to moderate competition. So Tenet operates in 35 states throughout the U.S. With a growth of 61 hospitals, not cut and paste, and it generates about $20 billion annually. The clinic sites include hospitals, surgical centers, and clinics, and they are in both metropolitan and rural communities, and they include all trauma level hospitals. HCA operates in 20 states. It was established in 1968 with a growth of 180 hospitals, and it generates $61 billion annually. It's physician-driven, population growth, aging population with an established presence. Number 2 is buyer power, and this ranks high on the Porter's 5 forces. It is community-driven, and customers depend on quality for quality, fair pricing, value, reputation of facility, physicians that work for the hospital. Physicians are well trusted with good customer satisfaction, 50% or more profits with good quality, and there is good positive respect, innovation, and compassion. The charge master sets prices based on geography, economic factors in the area. And then there is continuous quality improvement with evidence to identify barriers and improve outcomes for patients. Quality management systems are utilized to implement, organize, and standardize improvement activities to improve the services to patients. And the 6 domains of healthcare quality are safety, effectiveness, patient-centered, timeliness, effectiveness, and equitable. Number 3 is supplier power, and this is ranked medium. Group purchasing operation to manage materials, supplies, and technology on site for better patient care. Ability to negotiate supplies, manage operations and medications, food services, and inventory. And then purchase in bulk, collaborative, and informative. As well as the automatic ordering to maintain real-time flow. Unions are represented in the hospitals, and they advocate for jobs and quality patient care. Number 4 for Porter's 5 forces is the threat of substitutions, and this ranks medium. Because of the size of Tenet and HCA, a great deal of assets and equity exist, and then they push out new entrants in the market because of their size, and they have monopolized the markets pretty well. Substitution, they may shake up community, losing some patients short term, and this also can lead to unstable pricing. There are no exit barriers, and then the brand image builds loyalty via employees. Technology and innovation eliminate threats with advanced procedures by technology, clinical trial runs in the hospital, higher innovation with medical breakthroughs and research, and then partnerships with J&J Pharmaceuticals, and then Tenet partner with Catalent Pharma, personalized medicine, and then finds cures faster, and then it also utilizes genetics. Number 5, for Porter's 5 is the threat of new entrants, and this ranks low. And again, this is because Tenet and HCA are already well established, and they have lots of loyal employees and customers. Low pricing of competition is not sustainable to get into business because of high costs of starting out these healthcare businesses. Strong community ties lead to lower threat of new entrants as well. And then the national recognition and awards for service. Tenet and HCA are distinguished brands that set them apart from other competitors. And then magnet status and high quality patient care, nursing excellence, and innovation. And then circle of excellence includes a high quality care, service, and operational performance.
Okay. Business description. Tenet Healthcare has been built with 3 firms, Conifer Health Solutions, United Surgical Partners International, and Tenet. They have 475 ambulatory surgery facilities, 61 hospitals, and 110 outpatient clinics. They are healthcare focused, revenue cycle management, and value-based care solutions. They employ high caliber medical professionals and service customized for each location they serve. They use a collaborative approach with business, excellent daily care for patients and their families, and they are performance driven. HCA Healthcare is one of the top firms in the country with 2,300 plus locations, 182 hospitals in 20 states, and they also have a presence in the UK. They have surgical centers, ERs, urgent care facilities, diagnostic clinics, and imaging centers. They have 290,000 employees that work in patient care, and 37 million patients are seen every year. They are a learning health system. They are also innovative with advances in healthcare, and they share their knowledge within the community and with the government. Capital investments are land, buildings, and equipment, and they use taxes to pay for community redevelopment, including free care, discounted treatments. The risk factors are with Tenet Healthcare. Baby boomers are retiring, so the younger generation needs to replace them with buying power or spending power. The demographics with aging population could also be a risk factor. Where hospitals are located. There are loyalty issues, and younger generations want to try new facilities, so their loyalty is not comparable to baby boomers. They have a large, Tenet Healthcare has a large client base and react to rapid demands of specialized markets with technology. They have, there may be some legal actions and costs associated with those legal actions, and that may also reduce the growth in markets. But their goal is patient satisfaction, fair pricing, loyal employees, being close to patients' homes in the community, having preferred MDs that patients like to go see, and high quality care. HCA Healthcare has a large workforce as well, a large presence in the US and UK, and they strive on quality of care. They're very competitive in markets. Some risk factors are maybe new healthcare facilities or hospitals moving into the area, patient population shifts, maybe unfavorable legislation, and customer preferences. There may be resistance from hospital staff with initiating change in the facilities and with operations. Local competition in the market reduces profit margins, and with higher salaries in healthcare and growing medical fees, that could also be a major risk factor with hospitals. Also, innovative technology.